complete scalp exam, checkup, paying special attention to kind of these outer areas, having a look at your hair. Now it looks like your class did have a recent outbreak of lice, which of course is completely normal. I just want to make sure that you are not affected by it. So I'm going to be looking at any possible eggs as well as active lice itself, and then we'll kind of have a look and see if there's anything we should be concerned about, okay?
Okay.
Okay. So we're just going to have a look, and let's start with just a basic visual inspection. So I'm going to move your hair around a little bit, kind of see if there's anything that I should be concerned about. So I'm going to be looking at both sides, and I'll just kind of be moving your hair around accordingly just so that I can visualize everything. So paying special attention to these areas here. Just gonna have a look around as well at the skin. Oh, that looks pretty clear. Just having a look at this side. So far, not noting any abnormalities there. So I'll have a look with my light briefly. Just looking for any abnormal discoloration of the skin here, anything that could indicate possible abnormalities. So far, I'm not seeing anything. Now, I do tend to find that eggs and even active lice like to hide in areas around the nape of the neck as well as the ear, so just making sure to thoroughly inspect these areas. So just gonna have a look at the hair itself. Continuing on with my examination of this side, I'm just going to have a look with my light. Look at the ear on this side as well. I'm going to set your hair to the side for just a second so I can have a look at the back. So just looking to make sure that there's nothing concerning here at the base of the neck. As well, just having a look at the skin on your back to make sure that I'm not missing anything. Sometimes we can have abnormal reaction that kind of carries down here, so just want to make sure that there's nothing concerning here as well. Just having a look at your hair. Looking for any signs of active lice here, which so far is not notable. Now, you didn't say you were experiencing any symptoms, which is why I'm not particularly concerned. I did just want to make sure. Your hair itself appears very healthy. Not noting any signs of excess breakage or damage. Just having a look at the ends, looking for any signs of abnormality there. Any weakening of the protein bonds. having a look here. Just going to section off a very small section of hair here so I can have a look. And they're very healthy. Use this specialized comb. Okay, so just continuing with the scalp exam, I'm going to have a look at the top portion of your scalp and see if there's anything concerning here. So I'm going to have a look at your hairline where you part your hair. Having a closer look here, I don't see anything abnormal so far, so that's a good sign. No signs of active lice. I don't see any movement or signs of infestation here. So I'm just going to go ahead and section a couple of areas here. So far, everything looks okay. Scalp color is very normal. Notice any signs of abnormal reddening or erythema of the scalp? That's a very good sign. So just gonna have a little bit of a better look here. Just gonna hold your hair. Just have a look at the back of the scalp here. So just looking at the nape of the neck. For any signs of abnormality here. So far, not seeing anything though. Just gonna take a little bit of hair out at a time. Just going to perform a couple palpations sensations with my hands here, so just let me know if any of this sounds uncomfortable or tender. So I'm just feeling around for any areas that are particularly concerning, any lumps or bumps, any indication of injury. Experience any headaches ever? No. No. Good. Good. So I'm also just going to feel around the neck. Just feeling at the base of the cranium here. Feel maybe just a little bit of tension in the neck here. Could be normal, just feels like normal strain. Still feeling a little bit of tension here at the shoulder as well as at the neck. So I'm also just going to feel around the hairline. Specifically around the temporal region. Just feeling for any signs of inflammation here. So far that feels okay. Just feeling for any swelling. Just gonna feel at the back of your scalp again. So I'm just gonna feel around your hair for a second, see if I feel anything concerning here. Just a bit of some gentle hair tugging here. I'm going to check the kind of integrity of the hair follicle. So you're going to feel some very light tugging. It shouldn't cause you any pain. If it does cause you any discomfort, just let me know. I would say at this point we've pretty much ruled out the chance of any signs of infestation. So I'm just completing a regular scalp exam, making sure that everything else is intact since I have you in the office. Just gonna have a look behind your ear. Just palpating along the ear itself, feeling for any signs of abnormality here. Just Gently pinch at the skin, feeling the overall texture, and of course, palpate behind. I do feel just a little bit of excess warmth in this area. I'm just going to go ahead and check that with my thermometer. Okay, so it is just a little bit warm here. It does appear that you are holding a little bit of tension. Couple readings that are out of the normal range. I'm just going to percuss around this area, and I want you to let me know if any of this is uncomfortable. Just working my way down. Good. No pain or tenderness there? No. Just going to use this tool to test for any signs of active swelling. So this is just going to allow me to very gently press and compress any pockets of fluid that could be present in the scalp. Just going to press along these areas and notate any signs of abnormality here. So being very gentle around the temporal region. I'm sensing just a little bit of swelling here. So definitely some swelling in this area on this side of the neck here. I'm just going to follow that down the shoulder. Test along the clavicle as well. I do see there's just a little bit of edema here on my right side. Again, not as much on the left. The left side doesn't seem to be as affected, which is interesting. Do you feel that you hold any kind of rigidity in your shoulders or in your neck at all?
Maybe a little.
A little bit? Okay. Just going to take a couple measurements here and see if I'm noting any that's like indicative of edema or fluid buildup. So I'm going to measure. Apologize, this tool is very cold. I'm just going to measure here along the side of the neck. Maybe just slightly edematous here. Doesn't appear too bad. We have about an inch. Let's carry down the shoulder a little bit. Do you notice a linear pattern of swelling there? The jawline appears normal. I don't note any swelling there, but I do just want to check to make sure this isn't a lymphatic issue. So just palpate along your jawline here just to make sure. So just feel underneath the chin. Just palpating along your chain of nodes here. Looking for anything concerning. Make sure there's no signs of edema that are possibly related to the tension. Using the pads of my fingers to feel around. Definitely some tension here. I do think that maybe I could do a realignment. Have you ever seen a chiropractor by chance?
No.
No. Okay. So if you're comfortable, I'll have you just hold that position for a second. I'm just going to see if I'm noting any misalignment here. So I'm just going to have a look. The shoulder. So it's the scapular indentation. Just making sure this is a head and neck issue and not so much a muscular skeletal issue with your spine, but that looks okay. Okay, you can bring your head back for just a second. Okay, so I think the last thing I want to do is just test for sensory component. Now this is going to be a very brief test. Assuming you can feel everything adequately, so you should be able to feel that this is pretty sharp versus this is pretty dull versus this is like a mild pinching sensation. Now what I'm looking for now is more of a reactivity in your muscles. So with certain stimuli applied to the skin, we get certain movements, even reactivity of the skin itself. So those little intricate movements are more so what I'm looking for. So you don't necessarily have to respond if you don't feel something. If you feel that it is abnormal though, feel free to let me know. Otherwise, I'm just kind of looking for a very specific reaction of the muscles. Okay? So just relax for me. I would like you to close your eyes. I find that you tend to have more of a natural reaction when you're just kind of relaxed. So I'm going to start here at the hairline, and I'm starting with very soft sweeping motions. so far. Getting a healthy reaction to the soft response. Getting normal reactivity so far. And it does appear bilateral, so that's a good sign. I'm going to try with our slightly sharper response here. Test one side. Gonna do one last test of the shoulder area. Did think I was getting more of an active response here, but I believe it is equal. And lastly, I'm just going to test quickly. Make sure that your linear integration is intact. So we have muscle groups that span the length of the back here, and they are all attached to your spinal cord, which of course is attached to your neck. So just making sure that these functions are intact as well. Very good. Alright, Miss Lucy. The good news is that I did not see any signs of infestation, which was your initial reason for your visit. So it does look like you were in the clear. You were able to avoid it this year. Now I know the annual or biannual outbreak is kind of inevitable, especially with the range of your students. So I'm glad that you were able to avoid exposure. I would, however, recommend that you be cautious, as it is still that time of year where lice tends to go around. And I did notice some tension here in this area, so I am just slightly concerned that you've got a little bit of overuse of the muscle on this side. You could do for either a visit to a massage therapist or possibly a combination of massage therapy and chiropractic therapy, where they would do a realignment of your neck, make a couple adjustments, have a look at your shoulders. I do see just a very slight misalignment here at the shoulder. Okay. So those are all recommendations that I would make to you personally. Now, of course, as for the reason for your visit today, you are perfectly fine. I didn't notice any abnormalities of the scalp itself, no signs of dandruff or flaking. Your hair is very healthy and appears to be intact, so there's no reason to worry. Thank you so much. Absolutely.